Thank you so much to each and every one of our speakers. What a tremendous amount of information and recommendations that have spawned so much dialogue and conversation. We've been monitoring it in the chat box. So thank you so much. And as a brief, I just want to thank our note takers who've been able to provide me and us with some high-level overviews of the talking points from the presentations. And thank you, Dr. Mary. What we learned from you is that the epidemic is not over and that some countries are doing quite well, especially in Eastern and Southern Africa, while others are not doing as well. And the variations are in demographics, particularly among women who have higher treatment coverage than men, but children lag will far behind and among key, and as well as key populations. We are very far behind in new infections. And again, with regional and demographic variations, things are definitely different across the globe. And it's important to remember that we always know that funding is way below what we need and in many ways has stagnated, plateaued, and decreased. And COVID has only exacerbated that. Ulysses Burley, Reverend Burley, provided us with a recap of AIDS 2020 and just reminded us that the epidemic and pandemic is being fueled by inequity. So we must emphasize human rights. We must emphasize the integrated health services, especially at community levels. That includes people of faith. Reverend Burley reminded us of the importance of PrEP and that we know it works very well when people have access to it, and that faith communities have been very instrumental in helping young girls and women, and that there is more work to be done, again, with children. We also learned from Reverend Burley's recap that health services must acknowledge that we have been missing men, and that it was amplified as well by Dr. Mary's presentation. But what we've learned from the COVID pandemic is that self-testing has become important in the time of COVID, and many discussions around co-infections, including HIV, COVID-19, and TB, are again important to have at the center of our conversations. Reverend Burley also helped us to underscore that for the first time, the epidemic modelers are including social enablers, which are very important for faith-based interventions. As we know, as faith leaders, we sit at all those intersections working to pull partnerships across civil society together. And Renita, we thank you so much, Renata, for your work. Your voice is strong and powerful, and you reminded us of the importance of young people. And just as Reverend Burley, you remind us about the social enablers that fuel and spawn this epidemic, but that is very important for us to listen carefully to other people's stories, especially young people's stories and those who are socially marginalized. Thank you for that reminder. We, again, have been monitoring all of your recommendations in the chat box, and we encourage you to continue to send them our way. All of these recommendations will be put into our capstone or in final project that we're presenting to you all, which is an advocacy portal that you'll be able to utilize faith-based capacity building and technical assistance on demand. So please submit your recommendations to us. And at this time, I'd like to bring in Dr. Mary. We have a few questions for you concerning your presentation. And I will ask them, I think we have Dr. Mary still. I will ask them, and here's the first question. And this comes from Mozambique. What are the strategies that you have seen that help to increase viral load suppression?
Thanks for the question. So I think it's a really good point. And it has a lot to do with making sure that we really support people who are on treatment and making sure that they can adhere to those treatment regimens and follow through with the required regimens, making sure they pick up their medicine, making sure they feel empowered to talk to their medical provider if they're not doing well on, if they're having bad side effects. So all of those things actually that faith-based organizations do to support and aid a person living with HIV on their medical treatment will be really important for making sure that you can continue to suppress that viral load. You know, I think it starts with that whole knowledge of status. And so making sure people are out there and getting their testing and testing when they feel they're at risk, and then getting on that treatment. And then that final step is, once they're on treatment, making sure that they're enabled and supported to reach services and to stay on that treatment, as I mentioned before. Thanks.
No, thank you. That was great. And just following up with the same line of questioning, there's several questions, and you mentioned this in your presentation, and it was only amplified with some of the synchronous moments by the other presenters concerning the impact of HIV in men, and why are we seeing sort of less men. You mentioned the integrated care services with prenatal services for women, but from your estimation, I would love to hear your thoughts on how do we bridge that gap with men and really ensure comprehensive and connected care for them.
Yeah, that's a great question. And I think one that's been discussed a lot in recent years. There's a lot moving forward at really making sure that services for men, for starting with getting tested, but also with staying on treatment, meet their needs. If you're coming into a clinic that's filled with pregnant women who are having a nice chat, but you feel odd as the only man coming into that clinic, you're not going to stay long. Similarly, if all of the testing clinics are only open during the hours that men are working, or doesn't kind of meet their requirements, then we're not going to get men to start testing or to stay on treatment. So it's all about that access of those men to services. And I think, you know, historically with all health issues, men tend to interact less with health facilities. So trying to figure out what will work for men. And I think we've seen some great examples coming out. I think of I think it's called the men's clinic in Lesotho. I'm not coming up with them right off my mind, but there's a lot of great examples out there of how do we engage better with men. And it's, you know, HIV is pushing the way forward to say, no, we've got to do this differently. So how do we do it? So I think those are just some examples. Thanks.
No, thank you. And I want to pull in Ulysses to the conversation as well, and ask you, Ulysses, there's several questions I think that are really apropos here. And one of the questions is that many countries still face some challenges of congregations and faith leaders having misconceptions regarding the compatibility of antiretroviral treatment and spiritual therapy. How can we address this challenge?
Sure. Thank you, Reverend Aquarius. I'm not sure I'm the one most qualified to address this particular question, but in my history, persons like yourself who occupy both faith sectors and civil society sectors, who are able to draw the linkages between what God created in medicine, but also what God created in nature, and that those things being the same, and being able to draw the parallel that both scientific research and faith at its core are about the sustainability of life and the sanctity of life. And in that, for me, both scientific investigation and outcomes from scientific investigation and faith practices are one of the same, in that both are geared toward life and life abundantly, and the extending of life. And so I think that we have to reaffirm this with faith leaders and faith communities, that science is something that God gave us to extend life. And because of that, it is 100% in line with our faith practices that also advocate for the preservation, the sanctity, and the abundance of life.
Thank you. And there are so many sort of scriptures from across faith traditions that just speak of the importance of us not just loving God with our hearts and our souls, but also with our minds, right? And
That's right.
and that means to be able to be expanded and to have some of our thoughts, processes, practices even challenged, right, with new ideas. I want to ask both you and Dr. Mary this question. And it pertains to what do you both see the impacts of COVID-19 having on new infections. And I know you mentioned, Ulysses, an uptick in self-testing, but in terms of new infections, are you all anticipating that there will maybe an increase, or are we concerned about that or not?
That's maybe a question best answered by Mary. She has the data more accessible. I can say from what I'm seeing here in the United States context that there might be upticks just in the sense of people not being able to access testing, whereas self-testing isn't as available here in the United States as it is in other places in the world. But also people already living with HIV whose supply chain has been interrupted as a result of COVID-19, whose providers are not as accessible as a result of COVID-19. So there's not just the fear of increased infections, but also fear of persons who have been virally suppressed, not being able to remain so just for the sake of the interruption in processes. And so that's what I gather from the United States context. Obviously from a social standpoint, we can say that in a time when we've all been asked to shelter in place and sequester in place, that behaviors that make us more vulnerable for HIV infection may have very well increased. And so those behaviors are increasing. The preventative measures in place are decreasing as a result of the barriers presented by COVID-19. And so I think it does, in fact, provide for a perfect storm, if you will, for more HIV infections. I hope Mary has data that suggests otherwise.
Mm-hmm. Thanks. That was a really good response. It's exactly what I would kind of add on to, is to say we are seeing disruptions in the provision of drugs, and it's mostly like getting it from the port of the production down, to countries where those drugs are needed. But what we've seen also is a major shift in countries to multi-month dispensing, and that's really saved us. And so when we pull in data on treatment, we're not seeing huge disruptions right now in treatment data. Where we are seeing disruptions, and just really building on what Ulysses says, and excuse me if I don't use the right title there, but what we are seeing is the disruption in women going to get tested. And so thus we could see an uptick in the number of new child infections. So that's really important. Then, as you're saying too, the self-testing, and if people don't know their status, they might not take the precautions that they would need. And thirdly, as people do have disruptions, although we're not seeing it yet, if they do get disruptions in their treatment services, we'll see viral loads going up and thus potentially more new infections. The good news is, though, that treatment doesn't look like it's having major disruptions in some of the high burden areas, or I should say countries. Where we're not getting good data from is some of the Western European countries where we don't have much information on what's going on with kind of disruption and how that's affecting HIV services. But yeah, and I think the last point, when you first started talking, Aquarius, about what the question was, there's also the question about how HIV and COVID, and whether people living with HIV are more likely to become infected with COVID. And there's really mixed results coming out of there. Out of Western Cape, South Africa, there was some suggestion that people living with HIV had higher mortality if they were affected by COVID. But yet data from London and from Spain were not showing that. So there's really kind of mixed results coming out on that, and I think a lot more research to be done. Thank you.
No, thank both of you, and that was great. I want to ask Renata actually a question around youth engagement. What a wonderful presentation you gave. I would love to not me only, but there are others who are interested in learning. What are some of the efforts that you've been engaged in to really bring in youth, and what is the best way to engage youth throughout the process of HIV prevention, treatment, and care?
Do you mean as it relates to our present situation within the
Yes.
COVID season? Well,
COVID and beyond.
Well, let me just start. For some small islands, it is sort of difficult because we don't have, there isn't a lot of young people living with HIV. For example, on my island, I don't think we have a lot of young people. What we've been seeing is a lot of young pregnant mothers, but adolescents and so on, no. For the Caribbean islands, they may have some, but there have been some challenges in sort of reaching out to them. So this is where we're at. But during COVID now, we've been having a lot of online webinars, and we have something that is hosted by PANCAP, the Pan-Caribbean Partnership Against HIV and AIDS in the Caribbean, where every Wednesday afternoon is a hangout session. And it's mainly young people coming on there, and we talk about different topics. So a lot of them has been around, you know, how you're dealing with COVID, what's people's mental, what do their mental, the space, their mental capacity, or where their head is right now. And yeah, I was actually one of those who sat on a panel discussion where I had to speak on HIV, COVID and HIV. Similar to what I brought up in my presentation, I spoke about depleting, well, having less medication, which is a scare for a lot of Caribbean islands because our funds have been depleted. So what we used to get is not anymore. And for us to, because we are small islands, we have to sort of get our ARVs in bulk. So it's a group of islands, we buy the ARVs in bulk and then distribute it to smaller islands. So it's a bit difficult for us. So now, you know, instead of getting 3 months of supply, you can only get 2, and I am hoping there won't be a time where we can only get 1 month. So it has a major impact on young people living with HIV, and let's see, and our social life as well. So for young persons from the LGBT communities, you know, spaces where they would usually go to socialize or meet with friends, it's no longer available. These spaces are closed, you know, and there are curfews in different islands. We in Dominica are fortunate enough to not have a lot of cases. I think we are back down to 4, and at one point in time we were COVID-free, as in not having any active cases. And so it's a struggle to not have the cases coming in, because, you know, also for these Caribbean islands, we are reliant on the tourism industry. So you have to open your borders, you have to open your airports. So even though we try in country to try and keep the cases at bay, when people come in, they come with it. So it's been very interesting, I think, for young people in the Caribbean and for young people on the whole. We being part of the Y+ Global Board, I know that there were young people, or a representative from Latin America explained that he too also tried to do reach out for young people. So they had activities in the communities and so on. So we are trying. I mean, it's difficult without a lot of funding because you can only do so much. But yes, there are young people engaging other young persons in the small way that we can. Yes, thank you.
No, thank you. Young people engaging other young people. Thank you so much, Renata. And thank you to all of you who have tuned in to this first session of day 2 of our virtual conference. I want to say thank you. And at this time, we're going to transition to session 4, which is entitled Using Data to Document the Impact of Faith Models, Posters from AIDS 2020. And that session will be moderated by Dr. Susan Hills. Dr. Susan Hills, thank you.